Good evening. It is the latest tool to address surging wait times at Ontario's hospitals. Lakeridge Health in Durham Region has launched a wait time tracker for their emergency rooms. While helpful, Lakeridge themselves admit it doesn't address the underlying issues causing those long wait times. And tonight, advocates say the Ford government is being neglectful. A visit to the emergency room can be daunting enough, but made worse by the currently unpredictable and volatile state of Ontario's healthcare system, with staffing shortages forcing some hospitals to scale back operations, resulting in staggering wait times.
We have a staffing crisis, the like of which we have never seen. No exaggeration.
To ease the public's anxiety, Lakeridge Health in Durham, the latest to launch an emergency room wait time tracker, which gives the public an estimate of how long the wait will be at their 4 hospitals across the region.
Can you imagine a flight that says it's going to take off at some point, rather than giving you an actual departure time? And so this is something that I think the public has wanted.
The wait times are refreshed every 30 minutes and not intended for people with life-threatening emergencies who will be seen immediately. And while it's a helpful tool for patients, it doesn't address the root causes of long wait times.
The actual wait times in the ED are not, of course, solved by having a tracker. This is more about transparency to our public.
A leaked report on hospital emergency room statistics from Ontario Health revealed for 9 out of 10 patients, the wait time for an initial assessment by a doctor in emergency is up 50% from before the pandemic to 4.9 hours. The length of stay in emergency rooms for patients being admitted to hospital but waiting for beds was up to 44 hours for 9 out of 10 patients.
It's a rolling disaster, and it just has to end. We need to restore hospital capacity and deal with the staffing crisis and, apps and all of that stuff. It's just kind of rearranging the deck chairs on the Titanic at this point.
In a statement, the Ministry of Health tells us in part, once fully implemented, the next phase of the plan to stay open will add up to 6,000 more healthcare workers and free up over 2,500 hospital beds. Advocates say 6,000 is not nearly enough.
It's a ludicrous statement. It just underlines how little they're doing. We're about 50,000 staff short. That's nurses, health professionals, PSWs. It is negligent on the part of the Ford government to do so little in the face of this crisis.
One solution she suggests is to launch a recruitment strategy with financial incentives to bring back retired staff for 4 or 5 years in order to train new staff to replace them. Another is to repeal Bill 124, which caps wage increases for public sector workers at 1% annually.
Their workloads are beyond anything anyone has ever seen. And we have wage restraint legislation and refuse to take it out, even as there's a mass exodus of those workers. It's loony.
And as for the ER tracker, other hospitals that have implemented similar tools include Markham-Stouffville as well as William Osler Health Network in Peel Region. As for William Osler, they are the latest to tweet that they are experiencing longer than normal wait times, Sick Kids issuing a similar warning last weekend.